So let's see how the Radiant Dicom viewer works on the Windows laptop. It is a free Dicom viewer which we can download on our Windows laptop. So you can download it after searching it on Google, and you will be redirected towards the official website, and on opening it you will get this. So you can download it from the official website, although it is a trial version, but after the expiry of the trial version you can re-download it and you can use it again. So once after downloading it, a shortcut will be created on your desktop and you can open even the zip files also. That is, without even extraction of the zip files, you can directly view them. And even if you have the case like CT images or ultrasound images or even MRI images in a CD or in a pen drive, you can use the Radiant to use it, to see them. And after opening the case with this Radiant, the interface will be like this, and all the different kinds of images, for example the different sequences in MRI or the different phases in a CT like plain CT, non-contrast or contrast CT, they will be shown here. And there will be few buttons at the top, and let's see how to use them. So just to view any particular set of images, just click on them and just drag them and put them here. So the case will be loaded, and after the loading is completed, this box will be filled. And similarly you will be seeing the cases being loaded here on the top of the screen. It is 77% loaded approximately. So yeah, once it is loaded, then you can just scroll it down and you can see the images. And then there are various buttons here. So this button is to just open the Dicom folder from, let's say you can use from where you want to see the saved Dicom files, you can use that. Or suppose if the CD is inserted, then there will be a symbol of CD also, and directly you can open the CD by clicking over the CD symbol that will appear here. And suppose you want to save particular images, export particular images, then you can click here. And more often you will use this window. For example, if I click here, then suppose I will click these two boxes, and if I have dragged plane scan here and compare the enhancement of a particular lesion or particular tissue simultaneously on plane and on contrast scan. So if I have placed my cursor here, then look at the bottom of the screen. This value will denote the attenuation of that particular point. For example, here in the lung, that is air, that is hypodense area, I have placed my cursor. So the value that is being shown at the bottom, it was negative. So that shows the attenuation at a particular point. And you can use it here also. And now the average attenuation will be shown for that particular point here. And on the other hand, you can use this tool, measurement tool, and you can put an ellipse here. And the average attenuation of this region is 60, and average attenuation of this area is 130. So that shows on plane the lever was not enhanced, and on contrast enhanced scan there is enhancement, that is increase in attenuation of lever. Apart from that, you can use this measurement tool to measure the length of any particular tissue like this. You can measure angles also, and Cobb's angle in particular. Suppose if scoliosis patient is there, and you can use that. Apart from that, suppose if you are reporting an MRI spine, then you can put three windows, and you can put T1 sagittal, T2 sagittal, and stir sagittal images here, and you can just scroll them simultaneously and you can look at the images for comparison. And then after that, there is one uh, tool here which is for annotations. For example, if you want to hide these annotations like the name of the patient and all those details, you can just uncheck it, and then these things will be gone. And then hide patient data, these kind of tools, you can use them. And then after that, this is the symbol for windowing. For example, if you want to use a default window, you can click like this. If you want to make bone window out of this, then you can click like this. So now it is bone window. And now if you want to see lung window, then you can click on it like this. And this is the pan for moving the images. And then this is the magnifying glass to zoom. And then this is measurement tool just shown by me. Then this is to rotate or flip the images, not used commonly. This is to view in a cine mode. And then this is very often used like MPR, that is multiplanar reformatting. It is not reconstruction, it is multiplanar reformatting. So once you have clicked 3D MPR, then this whole set of images will open like this: sagittal, coronal, and axial. And with the help of these reference line, you can correlate any pathology. Like suppose if a pathology is there at this vertebral level, how it is looking on axial and how it is looking on coronal, that particular point you can correlate, and you can also hide the images by clicking here. And then suppose you are seeing the scan, and let's say you want to rotate it slightly like this or this, you can use this button for that. And suppose if there is some asymmetry, like the scan is like this, then using this symbol, most often it happens in head, we use the symbol to rotate and you make this slightly symmetrical, so that it is easier to compare from right side to left side. And then this is again the window button, and more often what we use is this button, that is MIP, to usually see the lung nodules which can be missed in the normal images, because the lung nodules can be very small also. We can make the images MIP, that is maximum intensity projection, and this is the thickness. We can adjust this thickness by clicking and then dragging the mouse downward or upward, clicking here and then dragging it upward or downward. Usually for seeing this lung nodule, we keep it at around 4 to 5, and then we can just scroll the images, and if there will be any lung nodule, it will become more obvious. So MIP button is used for that, and we can adjust the MIP thickness by clicking here and then by just scrolling upward or downward. And apart from that, there is no particular use of this spatial 3D MPR. We can just cut it now. And after clicking this 3D MPR, we will be going towards a window where all the axial, coronal, and sagittal images will be shown. Or we can use coronal here to see coronal at the same window, or sagittal here to use sagittal images in the same. But we don't do that often. We use 3D MPR so that we can correlate axial, coronal, and sagittal images simultaneously and use a cursor line also. And then this is 3D MP, 3D images that will give you a 3D image, that is a kind of VRT, that is volume render technique, which will produce such kind of images. And on clicking the mouse and clicking the uh, mouse in the center, and you can drag it upward or downward to adjust the amount of tissue that you want to see, and it can produce even a 3D VRT, that is volume rendering technique kind of image for you. So such kind of images you can see also, and then you can rotate it also, and further ahead you can see to correlate it better. So yeah, that's it. That was all the basic things that you need to know.